Welcome to the Reflective Ecclesia podcast. Our aim is to edify the church towards deep thought and Christ-centered action. Let's jump right in. Hey everybody, welcome back. It's my honor to be back with Dr. Toombs. For those of you who listened to our last conversation about the effects of technology, you know how powerful of a conversation it was, and I'm looking forward to getting into this one as well. We're going to be talking today about suffering, death, a culture of suffering, death, or can we make a culture of healing as a church, as a society? We'll be getting into all these things, but for those who maybe didn't watch the first conversation, let me just take a moment to reintroduce my guest. I'm going to just walk back a little bit through her background, her career, and then we'll just jump right in. Dr. Toombs was the Associate Professor Emeritus of Philosophy at Baylor University in Texas, where she pioneered the Medical Humanities program. She's the author and editor of 8 books and numerous book chapters and articles on topics ranging from the meaning of illness and suffering to the effects of digital technology, to our previous conversation. Kay has traveled extensively around the world, the US, Canada, Western Europe specifically, to speak on all these topics. In 2022, you may be interested to know that Stanford named her as being among the top 2% of most cited researchers in the world in 22 different disciplines. Also in 2022, the Society for Phenomenology and Existential Philosophy inaugurated the S.K. Toombs Prize in her honor. This is an annual award to be given to junior scholars in the areas of disability studies. Now, in her work on the meaning of illness, she draws upon her firsthand experiences to discuss how cultural values shape the experience of illness and disability, and considering ways in which we can best promote healing and wholeness in the care of chronically and terminally ill patients, as well as in our own lives, not just for those who are chronically ill. Healing is going to encompass all of us, as we'll soon get to in the conversation. So, Dr. Toombs, thank you so much for being here. It's a pleasure to have you. Before we get into some of the ideas of your writing, could you just start with sharing with us your personal story, if you're comfortable, some of your own experiences, and if you wouldn't mind, some of the experiences of your late husband?
Yes, I'd be happy to do that, because the work that I've done in this whole area really has grown out of my own experience. When I was 29, I was diagnosed with multiple sclerosis, which, as you probably know, is an incurable neurological disease of the central nervous system, which is usually progressive. And what I also need to point out, in case there's anybody listening who has MS, I was diagnosed at a time before they had any disease-modifying drugs. So at that time, it was a very troubling diagnosis. But over the years, I've had MS for many years. I've had it for over half my life. Over the years, I gradually, MS can, because it's the central nervous system, it can affect many things. It can affect sensation, movement, vision. Actually, the first symptom I had was that I lost the vision in one of my eyes, which came back. Wow. But over the years, I gradually lost the ability to walk. And so I've been in a wheelchair now for over 30 years.
Wow.
However, it took 16 years before I got to that point. And every person with MS has a different progression, has a different experience. You cannot look at somebody with MS and assume you're going to be the same as them. And many MS patients, particularly now they have disease-modifying drugs, do not end up with disability. So at the time, I was not a believer. And so I actually essentially thought my life was over.
Okay.
But I just want to assure everybody that was not the case, that I actually got my BA, MA, and PhD degrees while I had MS and traveled all over the world while I had MS. And MS gave me the foundation for all the work that I've done. Now, in my books, I also refer to the fact that I shared the experience of the last 6 months of my husband's life after he was diagnosed with terminal cancer. And so Derek, but he was known as Dee and I actually met in North Africa and were miraculously reunited 5 years later in Texas. And we were married for 31 wonderful years. And so at the time that he was diagnosed, 16 ladies in the community helped me to take care of him for the last few months of his life. And it was an amazing experience. And I talk a little bit about that in my books, How Then Should We Die and Living at the Boundary.
If you don't mind, can I take a quick second before you continue? Our conversation today will be valuable even if you haven't read the books, but I would highly encourage anybody in the audience to check out Dr. Toombs' books, How Then Should We Die and Living at the Boundary, Healing and Incurable Illness. Both of these books are what a lot of the interview questions we're going to be going over today are based off of, and a lot of the experiences and studies and things she's going to cite are also addressed in these books. They're wonderful reads. I will shamelessly say, it made me tear up and cry quite a bit, but it was still very valuable, and I would recommend for anybody who's interested in diving into this further. But please go ahead and continue.
And what now?
Please go ahead and continue with the story, the last 6 months of Dee's life.
So, I've always been interested in end-of-life issues and in care of the chronically and terminally ill. And so I reflect on that experience also to talk about how we can care for those people who are terminally chronically ill. But I do want to say that I really feel that what I have to say does not just relate to people who are sick, because I think that the attitudes that we have to all the things we're going to talk about are things that can be helpful to all of us.
So instead of us viewing this as a conversation that only matters for those who might be, dealing with their own incurable illness, you're saying this is a conversation that can take place in the context of that, but is very much applicable to all of us. The things that provide for the healing of those who are very sick are the things that provide for our healing, even if we don't think we're sick.
Right.
Is that a fair way to say it?
Yes, I think that's right. And one of the things that I stress and that I talk about is how cultural attitudes shape the experience of illness, suffering and dying, and disability. And like I think we all suffer. I don't think there's a single person in this life who hasn't suffered. When we say suffering, we're all suffering. But you can suffer if you're not ill. I mean, last time we talked about the effects of technology, and we talked about all the young people who are depressed and suffering and actually ending their own lives. So you don't have to be terminally ill or chronically ill. And I think it has a lot to do with the cultural attitudes that we have.
Well, let's get into some of the concepts of your book, if you don't mind. In these books, you a second ago you said you can be sick without being ill. Kind of in a similar thing, you talk about cure as opposed to healing and wholeness, and these cure and healing are not the same thing.
No.
And can you unpack that idea for us a bit?
Yes. When I talk about healing, and one of the things that I am very determined to say is that healing is possible in all circumstances of life. And by healing, I mean healing relates to the sense of wholeness. And what that means is that I retain a sense of personal integrity and meaning, and it's not dependent on physical or mental integrity. And what we have found when we're talking about people with illness is that a sense of wholeness is connected to a sense of connectedness. And that means connectedness to other people, a feeling of connectedness to myself, I'm not alienated from myself. I'm not alienated from my body, no matter what the circumstances are. And we've also found that people's facing serious illness, one of the things that gives them a sense of wholeness is a feeling of connectedness to God. And one of the things about serious illness, if you are suddenly diagnosed with a serious illness, it causes you to think about all the things in your life that are important that you haven't necessarily thought about before. So when I say you can be cured and not healed, I often give the example of a woman who has been cured of breast cancer, but who has had a radical mastectomy and still feels a sense of loss because of the change in her body, and still suffers because of the change in her body.
Interesting. So that woman no longer has cancer and so is cured, but it's clear for anybody who interacts with her that she is not healed. The healing is a very much deeper thing than the cure.
Yes.
And so it could go the opposite way. You could be healed but not cured,
Yes.
and cured but not healed.
Yes, for example, and one of the things I want to point out too is suffering is not the same thing as physical pain. You can have pain and not suffer. And when I think about maybe a woman giving childbirth, she has pain, but she's not suffering in the sense that she's bringing a new life to bear.
The experience of that pain is not the same.
Yeah, suffering has to do with the loss of personal integrity. We suffer when we no longer feel whole. So you can be healed and not cured, because you can live. I mean, I live with an incurable disease and I live with disability, but I feel a sense of wholeness and meaning and purpose. And so healing is possible in even in the ending days of life. But one of the things I want to point out, and one of the things very important for us to understand, is that healing is not a solitary endeavor. We need other people to be healed. We need other people to affirm us, to give us a sense of self-respect, and to allow us to retain a sense of wholeness.
Okay, so let me try to summarize what I'm understanding so far, and we'll move on. Healing is not the same as cure. Cure is in some ways a more surface level concept. Does the body function the way it should or shouldn't? Yes or no? Like, that is your body actively in terminal decline? Yes or no? Like those types of questions, which surface isn't the right way to say that, but it's just a different category of question than, are you suffering? Are you healed? Are you whole? Like, what is your experience? And you can have that deep healing whether or not the external body is or isn't doing whatever.
Yeah.
And you can have the other way. Okay, but finding that internal healing, then you're saying, isn't just a matter of like hum and align your chakras and think better thoughts. You're saying it's a community effort to retain that sense of wholeness. Okay.
I think it'll become a little clearer when we talk about some of the things that I talk about that prevent loss of wholeness.
Okay, so let's kind of go the opposite way.
Let me just say something about cure, because I think it's very important. Cure relates to, I break my leg, and we do certain things, and my leg is restored. So I've been cured, right? If I have an incurable illness, say I have rheumatoid arthritis or something, and my leg hurts all the time, and I'm not going to be able to heal it in the sense that it's not just going to go away, then I'm not going to be able to be cured. But we can help that person to live a meaningful life, even though we can't just fix. And the problem is, and I will talk about this a bit later too, is that we expect medicine to fix us. We go to the doctor because there have been great advances in medicine, and we go to the doctor expecting to be fixed. And we hand over our body in a sense, to the doctor to fix it. Well, if he can't fix it, then we feel an enormous sense of loss of control. And
okay, loss of control, loss of wholeness. We've thrown out a couple concepts. To better understand not just what you're trying to explain, but also why we're having this conversation. Why is it important that people understand this? Let's talk about how our culture currently responds to those who are ill or suffering or near death. Dr. Toombs, in reading your books, you talk about the experience of illness, or several experiences that go along with illness. One would be the loss of wholeness. Another would be loss of control that you just mentioned. But you also talk about loss of independence, loss of certainty, loss of the familiar world, and loss of voice. And you kind of present these as a suite of different bad things that can kind of come along with the way our society currently treats illness, or the way we ourselves are conditioned to respond to our own suffering. So let's just start from each of those. Unpack more what you mean by the experience of loss of wholeness.
Okay.
And then we'll go on to familiar world and all that.
And let me just say that these are characteristics of the experience of illness. So I could have MS and another person could have some other disease, asthma or something, but both of us will experience these particular characteristics of illness.
These are the common elements. Okay.
Yes, and the first one that we say is loss of wholeness. And so what do I mean by that, and why do we feel loss of wholeness? Well, the first thing is loss of bodily integrity. You know, most of the time we take our bodies for granted and we pay no attention to what's happening with our body. I always used to say to my students, if I asked you to describe what it felt like to put your shoes on this morning, they would have no idea, right? But if you had lost the use of your arm and I asked you what it felt like to put your shoes on this morning, you would be able to tell me, because illness causes an immediate shift in attention, where rather than just taking my body for granted, I have to pay attention to it. So if you're listening to me right now and you all of a sudden have a headache or your back starts hurting, your attention will shift to your body. So the body, part of the loss of wholeness is that the body asserts itself and it gets in the way. I have to pay attention to my body. I have to overcome whatever the problem is in order to carry out my plans and projects. So I experience a loss of wholeness in that my body now seems to be in opposition to me. And there's another thing, that loss of bodily identity.
Okay.
You know, most of us, not most of us, all of us, we have a bodily identity where we recognize, and you recognize me once you met me because you've seen me, and we have a familiar way of being. For example, I can remember not too long ago watching a video of myself walking, and I could hardly recognize myself walking. My husband said to me, "Weren't you tall?" I said, "Well, I'm still tall, but I'm just sitting down."
Yeah.
So that when your body changes, and this happens with elderly people too, you know, they're no longer young, their body is no longer the way it used to be, and there's a sense of loss with that.
So can I just jump in here and I guess inquire? Okay, to make sure I'm understanding, you're saying my body, or like my body is in opposition to me, implying that I am not my body, that I am observing my body, or my body is a piece of me, but my body is not all of me.
Yes.
And that may be something, if somebody hasn't gotten to that point and they kind of, I am my body is me, and then they lose part of their body or the function, it's not just that now there's no longer something occupying the space right here. It's a part of who I am is gone because there hasn't been that separation.
Yes.
Is that a fair way to explain it?
That is fair. And the other thing, we'll talk about it later, but I'll talk about it now. When I talk about loss of the familiar world, one of the things that we tend to think about is that I have a body. It's my body. You know, But we don't just have a body as we have a house, a car, or a dog. In a fundamental way, I know this is a kind of funny way to put it, but I am my body. So a problem with the leg is not just a problem with the leg, because the leg is the possibility that I have of running up the stairs to see my child, of playing tennis, of running down the street.
Yeah.
So
It's tied to so much more.
yes. So the body and the world are intimately connected. That's, of course, phenomenology talks about that our bodies are bodies in the world, because everything I do in the world, I do through the medium of my body. So when my bodily function is disrupted, my familiar world is disrupted. And we know that, for example, if you sprain your ankle and you have to use crutches, you recognize that the familiar world is not the way it used to be. Stairs are a problem now. To go opening doors are a problem.
Yeah. Okay.
And so the world itself also becomes problematic.
That's, man, I don't know if I would have, those of us who aren't immediately struggling with something like that probably don't realize that, you're one injury away, not from just having, I can't use my left foot anymore, but from the landscape of everything you see being radically altered, because, your leg is not just, an asset like a car or your bank account. It is part of you and fundamentally shapes what you're capable of, who you're going to be, where you're, like, what you're able to do. Like, it's a much deeper blow to identity than you might think. Until you're going through it and are now forced to confront this new reality. Is there anything else about the loss of the familiar world that's worth unpacking, or should we move on to the next kind of list of the experiences?
Well, I think it's interesting that we move around the world with virtually paying no attention to the moment. People who do mindfulness want you to pay attention to the moment. But it's not just if you have a serious disability. We tend to think of space as being an objective distance, but it's really not. When you are sick, if you have the flu, the bathroom, which used to be near or you never even noticed the distance, is now all of a sudden far.
It's miles away now.
Right? High and low are a function of your bodily capacity. What's high for me, a light switch might be high for me because I'm in a wheelchair. Stairs, you never pay attention to stairs, right? But if you're not feeling well, if you're very fatigued, or you suddenly notice those things. So that's why I say the world becomes noticeable.
Let's move to the next experience that those who suffer often have, the experience of a loss of independence and self-respect. I guess experiences would be the right way to say that. Can you unpack those experiences, loss of independence and self-respect?
Yes. One of the most difficult things about accepting loss of function, disability, is that there is an incredible emphasis in this culture on autonomy, independence, radical individualism. And by autonomy, I mean the notion that I'm free to do my own thing without any boundaries, without any limitations. And so given the emphasis on autonomy, we celebrate self-determination. I should be able to choose. I shouldn't have any limitations. You shouldn't prevent me from doing what I'm doing. So we are encouraged always to be able to stand on our own 2 feet, look after ourselves, and not be a negative restraint on others. Consequently, people who have to ask for help feel guilty. Dependence is seen to be a weakness. If I'm depending on you, I'm supposed to be weak. And so if I have to ask for help, I feel ashamed and I feel like I'm a burden on other people. And, I in my book, How Then Should We Die, we're not going to talk about it today, but I talk about how that sense of autonomy, independence, being able to do whatever we want to do, has led us into the whole issue of physician-assisted suicide. But the problem is that research shows that 55% of people who ended their lives by physician-assisted suicide did so because they didn't want to be a burden on their families.
Wow.
And, we see this with elderly people. They say, well, my children have their own lives to live, and I don't want to be a burden on my children, so I'll go and live in a nursing home. I read an article by somebody one time who wrote, I want to be a burden to my children. And the point he made out was, he said, they were a burden to me. I had to go to endless, terrible piano recitals. And so, but what he meant was he wanted their family to have the relationship such that it didn't seem to be a burden.
Yeah.
I just thought of this. My husband and I were married for 31 years. So basically, he looked after me right up until the end of his life. But he never thought of himself as a caregiver because we loved one another. And when I had to help look after him, I never thought of myself as a caregiver. So, but the point is that really dependence is considered to be weakness, which makes it very difficult for people to ask for help. In a culture like we have, people find it very difficult to be vulnerable with one another. So that adds to the feeling of loss of wholeness. And
again, just to reiterate, this isn't just people who maybe are bedridden with terminal cancer. This is an experience we all can feel, even if we're not suffering with a major illness.
Right.
Like hey, I'm financially very much struggling, or hey, like I'm super stressed by this thing. Things that are not as serious as cancer, but are still stressors, like the same radical autonomy thinking that we have come to view as the ultimate good is keeping us, even in those situations, from reaching out and being vulnerable, asking for help, doing life together, when the reality might be that if we all kind of laid down our guns, so to say, we'd all be perfectly happy to be supporting each other more so than we are now. And we might not even view it as a burden to care for somebody. It might even be viewed as an honor to care for somebody.
Right. And, I know in my life that because I talk about these things, I make myself vulnerable. And in so doing, other people feel that they can share their vulnerabilities with me. I mean, it's interesting that we recognize that if we can be vulnerable with another person, they can share their vulnerability with us. We don't have to be the person who's so successful we don't need anybody. Because actually we all need other people.
Let's keep going to some of these other facets. With loss of self-respect specifically in your book, you talk about a thing that contributes to that is the not just emphasis on autonomy, but the emphasis in our society on what you call doing.
Yes.
On doing in our society. So what do you mean by our emphasis on doing? How does that contribute to loss of self-respect?
Well, we have in this culture we have a particular emphasis on doing. So self-worth is considered to be a function of what you do. You ask people, so you meet somebody and you go, oh, what do you do?
What do you do for a living?
And when we say to our children, you can be anything you want to be, what we mean is you can achieve worth by doing. And we consider worth according to certain cultural values. Making lots of money, being successful in politics, or
famous,
so. If I read an article by Ezekiel Emanuel, who was a well-known bioethicist, and he said that when he got to be 75 years old, he was going to accept no medical care, including preventive medical care, because when he got to be 75, he would no longer be useful. Well, we don't want to judge people simply by their use. But the message that we get from our culture is, if we can no longer do, we're no longer worthy of respect. And you see that with elderly people again, people who retire and who then feel like they have no meaning for their life and they're no longer worthy, So when I can no longer do, I feel diminished.
Treating people, you're saying, like we can treat each other or treat ourselves like that guy you mentioned, like a tube of toothpaste. Like, I'm going to squeeze you out every last drop, and the second I can't squeeze anything more out of you, into the trash.
Right.
Like, is that kind of the...
Right. Well, yeah, because, I contrast that with the importance of being, and I guess I can talk about it now. Especially for Christians, the most important thing is being. Being has to do with character. What kind of a person am I? And when I focus on what kind of a person I am, it doesn't matter what my physical state is, and it matters what I do. It matters what I do in terms of, is it an honorable thing? Am I helping other people? But I was once talking at a conference for people with Parkinson's disease, and a lady stood up and she said to me, I always thought when I became a grandmother, I would do a lot with my grandchildren, but now I got Parkinson's. But she said, now I realize I can be for my grandchildren. And it was a very freeing recognition for her. We can always be. And I have known several people who have died, including my husband. At the end of his life, he could do nothing, absolutely nothing. But he could still be. He was still an encouragement. He was still a blessing. It didn't matter that he couldn't do anything. And that's what we remember. So I think it's important. I think it's important for our children to recognize that character is as important as what they do in terms of success in the culture.
For people, we've framed this conversation as kind of straddling the line of people who have disabilities, illness, but also people who don't, and how these are things that we all need to be aware of to be in community better together. But let's talk specifically about people who do have disabilities. What is it about disabilities in the U.S. That make it particularly hard for the person with a disability to retain self-worth? And why is that?
Okay. Well, we have very negative attitudes towards disability in this culture. There is a great focus on youth, physical ability, beauty, and those kind of things. And people who are able-bodied presume that a person who has a disability necessarily has a negative life. When I would go around in my wheelchair and people didn't know who I was, they presumed that my life was negative. They presumed that, I didn't have a meaningful life. But the way that people treat people with disabilities also causes them to have loss of self-respect. For example, if I'm in a manual wheelchair and someone is pushing me, people address themselves to the person pushing the wheelchair and not to me. Oh. Would she like to sit here or, we used to go up to the barrier at airports, I can't go through the security thing. They would say to my husband, can she talk? And my husband said, yes. No, can she walk? And my husband said, no, but she can talk.
Yeah, I got you.
So, and many times strangers would say to me, not knowing my husband, aren't you lucky to have your husband? Now, that was not a reflection on my husband's character. They didn't know him. I was very lucky to have my husband. But it was a suggestion that I was a burden. and he was a saint looking after me.
Yeah.
I told him, nobody says to you, aren't you lucky to have me? He said, well, I am. I said, I know, but nobody tells you that. So the problem is that the people who are making the judgments are people who are able-bodied, and they know nothing about the life of what it means to live with a disability. I mean, 90% of babies with Down syndrome are now aborted in this country. In some countries, almost 100%. Because the assumption is from an able-bodied person that a person with Down syndrome is going to have a meaningless life, which is not true. I know several children with Down syndrome, and they do not have a meaningless life. They did a research study with 153 emergency care workers who were the people who would first see somebody who was brought in with a spinal cord injury.
Okay.
Only 18% of the emergency care workers considered that they would be happy to live a life with a spinal cord injury. Only 18%, whereas 92% of those who are living with a spinal cord injury said they were happy to be alive.
So people who are not experiencing the illness or severe disability or limitation are drastically overinflating the amount of destruction that is wrought by having that. Like
right.
The
And you see what an able-bodied person is saying, if I was in that situation, my life would be ruined. Well, that's an assumption, number one, you can't make because you're not in that situation. But that is an assumption that able-bodied people make. And now the overriding problem with that too, is that we have now got to a point in our culture where we have come to a judgment that there is such a thing as a life that is not worth living.
And conversely, lives that are not worth living.
Yes, and lives that are not worth living.
Okay.
And so that is leading many people to the assumption that ending one's life by euthanasia or physician-assisted suicide is a good thing because this life is not a life that's worth living.
Okay.
And so particularly the media has glorified the notion that it's a courageous act to end your own life by physician-assisted suicide. In the Netherlands and in Canada, euthanasia is now called mercy killing, medically assisted death. And a lot of people, a huge percentage of people who die in Canada are now dying by euthanasia because the assumption is that your life is not worth living in certain circumstances. So we really have to be aware of how much our thoughts about what it would be like to be in that position are dictating how we think the person's life is.
That is like very chilling to me. Like to thought like, okay, my assumption about a life worth or not worth living can be reflected in my voting choices or my politicians' choices, and can lead to the death, justified or unjustified, of people who actually had the scenario played out would not have had the experience that I imagine they would have had. But yet I took that in the name of mercy, and I'm not even reflecting on that because I'm viewing myself as having done a righteous deed in doing that. When the reality might be quite different. What you said earlier about the emergency room workers, 18%, thinking like, oh, that would be, I could not, that's not worth carrying on, versus the people who actually had it, the spinal cord injuries, 92% saying yes.
Yeah.
That shows that's not a difference of like 60-40. Like that's a very strong polarization split, which shows that like the way we view it is quite far
And the
off.
other thing is, so another question that we have to ask ourselves is, if a person considers their life is not worth living, what do we need to do to help them to feel that they do have a life that's worth living?
That's such a better question than if a person feels like their life is not worth living, what are the options we can present them to end their life?
Because many of they have, I mean, it's been quite a scandal in Canada with the move to medically assisted dying, that they have found that there are people with disabilities who say, well, they don't have enough income to live, they don't have a place that they can live, and so it's easier to end their lives. Well, and I'm sure there are people here who feel that way. And also, if your family basically abandons you, because, to me, one of the most dreadful things about COVID was how many elderly people had to die alone. I mean, that is just horrible. But I think the question that we have to ask is, okay, is there something we can do? For example, if I go somewhere in our community where they have steps going into the building, I mean, I could go, well, I can't go there. But there's always somebody there to lift me up the steps. So, it's not a question. Instead of the question being, well, is it possible to do that? The question should be, how can we help make it possible?
That's very challenging. We could camp out there the whole interview. For the sake of the other good questions that we've got to address, let's move on. Let's talk through some of the other experiences that those with suffering, illness, disabilities, or who aren't there, but can often feel. You talked about loss of control earlier. So, why is loss of control such a major source of suffering?
Well, we no longer in our society have a recognition of the givens, that there are certain givens in life, And so if things, and we have the idea that we are in control of our lives, which is really a very large illusion. We are not in control of our lives. And so if something comes in the way of that, we feel a great sense of loss. We no longer have control. And so in this climate, losing control is a major source of suffering. But I want to say that it's important to recognize that there is always some level of control that we can exercise. I mean, I can't control the fact that I can't walk across the room, but there is a level of control that I can exercise. I can make sure that, I can get around using alternative ways of getting around. I mean, that's just a simple thought. But when I was first diagnosed with MS, I was not a believer. I didn't believe in God. Well, I kind of did, but not really. But the thing that really helped me was I read Viktor Frankl's book, Man's Search for Meaning. Frankl survived the concentration camps. He lost all of his family. He lost his life's work. And he said, everything can be taken away, but the last of human freedoms, the freedom to choose how to react in any given set of circumstances. And that was incredibly freeing to me. Now, I'm not saying it's an easy choice, but it is a choice. So no matter what happens, I always have the choice as to how I'm going to react to this set of circumstances.
That can never be taken from you.
That can never be taken from me, no matter what.
So you don't put your identity in things that can be taken from you so much as you put your identity in the things that cannot.
Yes. And also, right after that, I'll talk about loss of certainty, because we assume, when we go to the doctor, we assume that he's going to write a prescription, give us some medicine, and everything's going to be fine. I mean, when I went to the doctor and he told me I had an incurable illness, it was like a huge shock to me. Other people got incurable illnesses. I don't get an incurable illness. And so my life was then very uncertain because I didn't know what was going to happen. But what happens is we always project into the future to the worst possible place.
Yeah.
And what I've learned with my husband's illness, with my own illness, is not to go to that place. That what we have to, every time we want to go, well, what happens if, we just say, no, I'm just going to bring it back to today. Okay, I know I can get through today, right? And tomorrow, I know I can get through tomorrow. And I also found it's much better to look at concrete problems and not imagined problems. I remember going, and I have to tell you this story about disability. But anyway, I remember going to the doctor and saying, well, I don't know. I don't know if I'm going to be able to keep teaching because I have to stand for 45 minutes. And he said, well, you could use a stool. And I went, oh, yeah. And then I said, well, I don't think I taught when you wrote on the blackboard. So I said, I don't know if I'm going to be able to write on the blackboard. And he said, well, you could write on, you could put up slides, that kind of thing.
Projector or something.
Yeah, and I went, yeah. So all of a sudden I was back in control.
Mm-hmm.
And when my husband's situation, rather than thinking, what are we going to do when he can't get out of bed, it was a question of, okay, so how do we help him to transfer right now? And doing that puts you back in control. And I want to tell you one thing about disability, because shame is also an experience that goes along with disability.
Okay.
And when I first was having difficulty walking, I had one of those 3-wheel scooters, but I didn't want to. I told my husband, I don't want to take it into the classroom because the students will think less of me. Mm. So I would ride it from my office to the classroom, get out, stagger into the room, and he said to me, that's ridiculous. The only thing they care about is, are you going to give hard tests? Are they going to know what to say?
Yeah.
So I said,
as a college student myself, not too many years ago.
So I said, you're right.
I agree.
So to lecture, I had to back the scooter in to the podium and then turn the seat around. And so at the end, an older student said to me, the students are in awe of you. And I said, oh, must be a very good teacher. She said, no, they can't believe you can back up so fast without
I said, no, you're a terrible teacher. You just you drive well. No.
See?
No. Okay, so let's build on this. We've talked about the experience that people who are suffering can have, disability or not, loss of the familiar world, loss of wholeness, loss of certainty, loss of control, and so on. But you talked about earlier that how the community treats someone with illness has a lot to do with how that person is going to experience their illness. Yes, we have our own choice about how we're going to view things, and that can never be taken from us. But the way people treat us can also make that choice a lot harder or easier. And in your book, you write about engaging with the outside community when you're disabled or ill can become very hard all of a sudden. You phrase it as a loss of voice and isolation.
Okay.
Unpack what happens there.
Well, with regard to isolation, we tend to withdraw from people who are seriously ill and particularly from people who are dying.
Okay.
So, and in our culture too, a lot of people die alone. They die in the hospital in an intensive care unit and they die alone. But we tend to withdraw from the incurably ill and people who are dying. And when I talk about loss of voice, I mean, for example, when I was first diagnosed with MS, some people withdrew, because and I didn't look like I had any symptoms, but I suspect that people knew what the diagnosis was and they didn't know what to say and it sounded terrible, and so they just withdrew. But when I talk about loss of voice, I talk about it in two instances. One is in the medical arena where there are, the medical history is different from the clinical narrative. The medical history is the results of blood tests, scans, so forth. And the clinical narrative is the patient's story of illness. I started my work because I realized that my neurologist, who is a very sensitive person, that when we had a conversation, we were talking about two different things. He wanted to know what was going on with my central nervous system, and I was concerned about how the illness was affecting my life. And I wanted him to understand or acknowledge what the illness was doing to my life. Of course, now the way medicine has gone and they only have 10 minutes for each patient, it's hard to do that. But so when the patient doesn't feel they can share their story, they feel like they have no voice. And it's the same when friends and relatives and other people don't want to acknowledge what the problem is, particularly if the person is dying. And so loss of voice is very isolating because the person feels like they're cut off, that nobody understands what they're going through.
So you've unpacked for us several experiences of suffering, and it might not be uncommon for someone to experience all of them at the same time. The loss of wholeness, familiar world, control, certainty, voice, being isolated. So that's the way things are happening now for a lot of people because of how we insist on radical autonomy. We treat death as this thing to not be faced. We put the emphasis on doing rather than being, and so on and so forth. What's a better way? How do we shift to a better way? So let me just read the question the way I wrote it. Like, we've talked about all the experiences that contribute, or the cultural values that contribute to the experiences we've discussed. How do we shift those values to, instead of making a suffering context around the person who is going through something, to make a healing context? How do we make a culture of healing? Or to borrow the title of your book, how then should we die? Especially in the context of a Christian community.
Okay. Well, in the first place, I want to say that I think recognizing the things that I've talked about, recognizing that these things are part of the experience of illness, that helps us to think carefully about how we are with other people, right? Are we contributing to those things? Or at least recognizing that the person has those difficulties. When I taught a medical humanities class, a student said to me, I just realized what my dad is going through because he has to use a walker at home. I just realized how frustrated he is and why he feels so bad about it. So, it is not a small thing to be aware of these things. But I'm going to talk basically about the context of Christian community, what I think we need to do as Christians. And the first thing, and the most important thing, is that I think we have to have a complete shift in values. That we have to reject cultural values, the foundation stone of Christian community is self-sacrificial love. We're committed to follow the commandment to lay down our lives for one another. So the emphasis shifts from radical autonomy to relationship. So we reject the notion of radical autonomy and we focus on relationship and whatever we can do to build relationships. We live our lives in relationship with God and with each other, and we try to set aside all those things that separate us from other people, like selfish ambition and worldly success, in favor of love and humility and service to others.
And to harken back to our previous conversation, the selfish ambition and all that definitely disconnects us. But technology, this kind of ties to our other conversation about how technology is also making the real relationship harder to access. So that's where that conversation kind of ports into this one. Is that fair?
Right. It is, because the emphasis is on building relationships with one another, real life relationships. Because in the conversation we had on technology, we said the word friendship has changed. Friendship, if you have a friend on Facebook, it's not the same as a friend. And community, the notion of community has changed. I belong to the quilting community online. Great, that's fine. But that is not community where people looked after one another, took care of one another, found out if somebody had a problem,
So a shift from radical autonomy into a shift to radical relationship.
Yes.
Okay, what else?
And with that, I'm going to say there's a shift from independence to interdependence.
Interdependence.
And, I want to read this from 1 Corinthians. I think about what Paul says. He says, if the foot says, because I'm not a hand, I'm not a part of the body, it's not for this reason any less part of the body. And if the ear says, because I'm not an eye, I'm not a part of the body, if the whole body were an eye, where would the hearing be? The body is not one member, but many. And he says, which I find very interesting, and we don't have time to unpack it, but we have time to think about it. He says, and the members of the body which seem to be weaker are necessary.
Interesting.
Yeah.
Specifically calling out for us to not discard or isolate or shun the weak among us.
And when I think about it, I think they're necessary, because it enables us and encourages us to care for one another,
Which is what the point is, to build up the love.
We had a child who was born with a very aggressive form of not cerebral palsy. But anyway, he died when he was 5, and he was very disabled, but he was very much part of his family, and he came to everything, and we all loved him. And after he died, his grandfather said, God sent him to us to make us better people. Because we did. We became more compassionate, more loving, more caring. So maybe that's what Paul means. I don't know if that's what he means.
And I'm imagining someone who is the voice of our current culture saying, yeah, but what did he do? What did that kid do in his life?
Right.
And
why was his life worth anything? Yeah. Wouldn't he have been better to have, newborns with severe disabilities are also euthanized? Wouldn't it have been better? But he had a very joyful life.
Right. And you can immediately tell, at least I can, intuitively, when you ask that question, yeah, but what did he do? I can immediately tell, you are way off of what the point of life is.
And what he did was to make us better people.
Yeah, it's
which is a whole lot more important.
Yes, who we are, the being rather than the doing. Yes.
And the other thing that Paul says that I find very interesting is he said God placed every member of the body in the place he wanted them to be. So we all have a unique place. Doesn't matter how old we are, how young we are, how physically able we are, how disabled we are, we all have a place in the body.
And we're talking about this, I keep coming back to this, we're talking about this in terms of the specific type of suffering that is a disability or illness. But this would apply to any type of suffering as well, that why did God make me have this certain predisposition, or why am I in this circumstance? And it goes beyond just simply why does my leg not work or something.
And now I'm old, what use am I to the body?
Exactly. Something we may not all be disabled, but we all will become old, Lord willing.
And we all have disabilities. I'm hopeless I've written the book on technology, but I can't use it. I am technologically disabled,
There you go.
So...
Well, anyway, carry on. What
the other thing is that given our beliefs, caregiving is the overriding ethic. So caregiving is a given. We don't think that it's a burden to care for other people because that's part of who we are as the body of Christ. And one of the things that I want to point out is that caregiving is a reciprocal relationship. The caregiver is not the only one who gives, and the care receiver is not the only one who receives. They both, they have a relationship with one another. And, you know, I know several people who have had terminal illness and were not able to do anything. Dee was not able to do anything. At the end of his life, he could hardly speak. But he always encouraged his caregivers. They loved him, so that enabled him to retain his sense of self-worth and self-respect. And in turn, he encouraged them. So caring for him is something that they will never forget. And it's something that was a blessing to them as much as it was a blessing to him. We had an elderly lady in our community who was dying of cancer, and she couldn't sleep at night. So a group of young people volunteered to go and sing for her through the night. And they said that that experience changed their lives forever. So I think if we can see caregiving as a form of communion rather than, you know, a burden, that it shifts our attitude towards caregiving.
Man, I don't even know if you realize what you just said. Caregiving as a form of communion. I was just totally separate. I don't want to derail this too long. I'll be very brief. I was just asked at my church to give a devotion on communion, the Lord's Supper, and sharing that. And as I was doing my studies and as I was leading the team, the group through communion, I had been accustomed to coming to the Lord's Supper, communion, viewing it as an act primarily between me and God.
Right.
Like, you know, the phrase, so let a man examine himself,
Right.
You know, kept coming to me. And I thought what that meant was let a man examine himself. You know, is there any sin, any wicked way in me between me and God? Let me repent, get that right, and then I can take communion. And because the verse, if you drink of the cup unworthily, you eat and drink damnation on yourself. And so that's how I was viewing it, and that's in there. But when you back up and read the surrounding context, Paul is giving that instruction in the context of people who are sharing the Lord's Supper and not caring for each other.
Right.
People are, in the Lord's, from what I can gather in the passage and from what I've been able to read, the Lord's Supper was kind of like more like a potluck style thing in the early Christian communities where everybody's bringing a meal of their own to the church and eating instead of coming to the church and having the elements distributed to you when you get there. And so some people would come to the church, and because they're well off, they're bringing in just a banquet for their communion portion. Somebody else might be poor and they've got a saltine cracker, and that's all they have at home. But they're gonna do. And when they all get to church with their, you know, bring in the cup and the bread or the food, whatever the feast, the people who were bringing and who had a lot to give weren't giving it, weren't sharing. There was someone right next to them who obviously needed something, but yet they were going so far as to get drunk. Like, not just to indulge, but to get drunk and exclude the person right next to them who clearly needed care. And so that was the context where Paul was saying, you know, when you take communion like this and you don't properly discern the body of Christ, that's when you are eating and drinking damnation on yourself. Is you're involving yourself in your Christian walk and in your relationship with God, and having this walk with God be something that's completely blind to the person right next to you. I know when you said, you know, caregiving as a form of communion, I don't know if you meant it as like the Lord's Supper, but that the phrase communion brought that to me. And this is a concept like that, I guess I'm linking with communion, the Lord's Supper. Like when we come to do communion together, we're supposed to do it thinking not just of what my relationship is between me and God, but what is my relationship with the person standing right next to me.
Right.
And the extension of that idea, then I'll wrap it up.
Well, and you know, I think of the fact that Jesus washed the disciples' feet.
Right.
That is a physical thing to do.
And we're not supposed to just do that
No,
during the times of
no,
communion. It's supposed to
no.
be like a way of living, a way of doing community,
Yes.
as you're saying.
And when I say it's a form of communion, it's a form of giving and receiving. But both parties are giving. And, one of the things that I know from my own experience is that we can encourage people who are going through difficulties, can encourage other people that they too can go through difficulties. And, recently I had to have heart surgery, and I had this anesthesiologist who was a very dear man, and I wrote to him afterwards and thanked him. And he said to me, "You've given me more than I gave you." Because he said, you came as an example of how it's possible to live a meaningful life facing the challenges of illness. And we can all do that, So, but I think it's very important when I talk about caregiving to say that as a community, as a church, as a body, we need to carry out caregiving, this ethic of care, in very concrete ways, in serving one another and praying for one another and talking to one another. The other thing is that, when Dee was sick, he was never separated. He was part of a web of interrelationships. The children came and they drew pictures for him and they sang for him, and people would come and pray for him and talk to him and be with him, and we can all do that.
Yeah.
And then we've talked about the shift from doing to being, and caregiving gives the caregiver as well as the care receiver an opportunity to develop character like perseverance, patience, joy, not grumbling. It gives us an opportunity to do that. And then, of course, one of the main things is the shift from instrumental work, from the doing, to intrinsic work, because we believe that every single individual is made in the image of God and has intrinsic worth. So the shift is from disability to uniqueness. Who is this unique person, not who is this disabled person?
What can this person do for me?
Yeah.
Who are they?
Yes.
You talked also a little bit about how it can be hard to be vulnerable.
Yes.
I can imagine that this would be something you'd have some thoughts on as well. Like, how do we need to make the shift away from control towards vulnerability?
Well, I think that the thing is that, for one thing, we need to accept that there are certain givens in life and that there are certain seasons of life. I think of elderly people, who think that their lives are basically no use because now they're old. There are certain seasons in life, certain givens in life, and we have to think about vulnerability. This probably sounds ridiculous, but as an opportunity, an opportunity to be close to other people, to allow ourselves to give up control. It's not easy to give up control because you want to be in control of your life. You want to be able to keep doing. And I remember, for example, I can think of an example of control. I wanted to be able to look after my husband and to take care of his physical needs myself. Well, after a certain amount of time, I couldn't do it. I mean, I just was not able to do it because it involved lifting and all those other things. And it was a struggle for me to give up that control to other people, to the people who came and cared for him. But those relationships that we form bonds of love that will never be broken, And so I also want to say that there are different forms of caregiving. I remember when I could no longer take care of his physical needs, that one night he was in a lot of pain and I was praying for him. And I felt God say to me, this is the most important thing you do. So, there are different forms of caregiving and we can do that.
definitely opening my eyes to avenues that just I haven't been fully considering before, just to be honest. And I think, your message is a good wake-up call to me to be more aware of what's around me, not because I need to do the honorable thing and sacrifice by being generous, but it's an opportunity for me to become and be better myself, to enter into a relationship with people who need care and who I can give care to and receive as a result of me
Yes.
giving. And so it's a very, maybe ashamed isn't the right word, but just sheepish to say, it's a very different way of viewing the world than I think I have been accustomed to viewing the world a lot of times. And this is a very good thing for me to grapple with. Let's transition. You have a section in your book, Living at the Boundary, where you talk about the concept of suffering and bearing witness.
Right.
There's a quote I'm going to read here, and I would love for you just to give me your thoughts on it. This quote really struck me. This quote was from, I believe you said it was from Michael Maine, the former dean of Westminster Abbey. As he was dying, he apparently wrote, "To die with gratitude for all that has been, without resentment for what you were going through, and with openness toward the future, is the greatest gift we can leave those who love us and who are left behind." Now, that perspective, I'm thinking of myself, being diagnosed with something that says, hey, you've got 6 months to live. I think my first instinct would be resentment, to be something was taken, and that headspace, dying with gratitude, is a dying with openness to the future is a headspace that I don't think is necessarily intuitive for me to get to either, but it resonates with me when I read it. And then that quote also shows that there can be immense meaning to be found in the suffering itself, not just the people who are who are caregiving. When I'm giving care to someone who's suffering, I can find meaning in that. But the person suffering themselves is able to find something through that. And to that point, I'll end the kind of my little spiel here. You had another quote at the end of the book where your husband D, you quoted him as saying, as he was suffering toward the very end, you quoted him as saying, "This is a healing experience for me." And so that cure versus healing, he is becoming less and less cured and more healed. And he's able, you didn't put that in his mouth. He said that. He said, I'm being healed as he's suffering more and more. So can you just, I know it's a whole word salad, but can you elaborate? How do you get to that perspective, and what is the meaning of that? What is a good death? Unpack that for us.
Okay. Well, first of all, I want to say that I don't want anybody to interpret anything that I say or what I say in my books is to say that dying is not difficult.
Okay.
Dying is difficult, but it can be beautiful. And so I want to talk a little bit about that. But when you say, well, what do you mean by good death? I just want to say that, in How Then Should We Die, I'm looking at two different responses. And the one response is physician-assisted suicide and euthanasia. Euthanasia means a good death. And the perspective that the only good death is to end it, is to take your own life or have your life ended. And that's the only good death. And what I want to say is that Christian values affirm that suffering and dying can be an occasion for profound and intimate caring relationships and can be an occasion for healing. So let me talk about that for just a little. But what I want to talk about, I'll talk about being with, how important it is to share.
Being with?
Being with.
The bearing witness.
Sharing with those who suffer.
Okay.
And Paul says when someone in the body suffers, we suffer with them. Mm-hmm. And suffering is an opportunity for the Christian community to express solidarity with the sufferer. So, for example, when Dee was first diagnosed with cancer, I thought of the Garden of Gethsemane, and I thought of the disciples who were sleeping, and it says they were sleeping because they were overcome with suffering. And I said to somebody that I was afraid I would not be able to witness Dee's suffering. I wouldn't be able to stand with him in his suffering. And he said, "We will stand with you." And knowing that people would stand with me and with Dee enabled me to be present with him throughout his suffering. And so, Dee was constantly surrounded with people. Grace comes through other people. The ability to have grace comes through other people. And I think when we think about, another thing that we have to think about if we're Christians, when we think about difficulty and suffering, we have to think of all the scriptures that tell us, well, first of all, it brings us to the reality of the cross, but we also have to think of all the scriptures that tell us that suffering leads to perseverance, and nowhere in Scripture does it tell us that we will not suffer. We have to recognize that suffering is a part of being human. We have to recognize that suffering is a given, but we also have to recognize that God is with us in our suffering. The Psalm, "Yea, though I walk through the valley of death, I will fear no evil," is true. I know it is true. And I also thought of the song, "Love lifted me when nothing else would help." Love lifted me. So one of the very important things is to be with people in their suffering, not to withdraw from somebody because they're suffering. I remember Nicholas Walterstorff wrote a book called Lament for a Son. His 23 or 26-year-old son was killed in a climbing accident, and he wrote a book. It was his journal about trying to come to terms with his son's death. But at one point he says, people say, "Well, I don't know what to say." And he says, "Don't say anything. Come sit with me on my mourning bench." And, I think that's so important to realize that that's something that we need to do with people. And so, so what about the meaning of suffering? Well, I never understood really. I mean, suffering is a mystery, but I never really understood the meaning, that meaning could come through the deepest of suffering. But what I understood what I experienced in my husband's dying was that the incredible love that we had for one another, that as our boundaries constricted, as our reductions got more and more, our love got stronger and stronger, until in the end there was nothing left but the love that we had for one another, the love that we felt from God, and the love that we felt from other people. And, with regard to the Michael Main quote, when he says, to die with gratitude for all that has been, my husband was always grateful. He was grateful for the life he had lived. He was grateful for the blessings that we had enjoyed in our marriage. He was grateful for everything people did for him. And there's a connection between grace and gratitude. If we can give thanks, if we can be grateful, God gives us the grace to go through. And I know that since my husband died, when there are moments when I feel his loss still very strongly, if I start thanking God for the blessings that we have, for all the blessings in my life, for what he's done for me and so on, by the time you've got through 45 different things, God gives you the grace to overcome it. And so I think, and the other thing is, if one dies in faith, that's different. It's a different, I mean, Dee said, when he was first diagnosed, he said, "This is not the end, it's a new beginning." So if you die in victory and you die in faith, love overcomes death. Now, it doesn't overcome the loss that you feel when a person is no longer here, but you know that I have faith that I'll see him again one day. So if you die in faith, if we really believe what we say we believe as Christians, then death is not the end, you know? So I think, a good death is one in which I can be surrounded by people who love me, in which I'm grateful for the life I've lived, in which I've had a chance to tell those close to me how much I love them, in which I've had a chance to make, make right any relationships that need healing, and most of all, one that reverberates with my faith. And so that's what I think a good death is.
We've talked about suffering, bearing witness, and I had an experience once that I wouldn't have had unless I was with somebody in their suffering. I've told this story only a few times in my life, and after I tell the story, we'll jump to the end of the interview here, the last couple questions. But there was a gentleman in our church. His name was John. And from the first moment I met John, you could tell that life had dealt him a pretty rough hand over the last couple of years. He was missing half of his nose, and just you could tell that his body was beginning to betray him. And he was very concerned that his family would come to faith, and he was trying to get into church himself. I don't think he had been a particularly devout man most of his life, from what I could gather. And so he was seeking, and one day I talked to him, and he starts bursting out in tears, and he says, I had a heart attack, and they brought me to the hospital. And so I thought, the story couldn't get any worse. I'm so sorry you had a heart attack. I'm glad you're okay. He said, when I'm on the operating table and they're getting my heart back going, they notice something and they check it out. I've got cancer all in my chest.
Oh,
and so double whammy. He's like, and they can't operate on me because my heart is too, I can't, so it's over. They tell me 6 months and I'm out. If that, and he was very shaken by it. And I and a couple other friends from my church, we banded together and we went to him as he was in hospice, and we visited him several over the preceding months. And every day, he was a bit weaker and weaker. We went maybe once a month or something like that and sang I brought my guitar, and it was a beautiful thing. And the last time I saw John, we knew it was going to be any day that he was going to pass. He had been moved out of hospice and into a hospital where they expected him to pass within 24 hours, 48 hours. So it was going to be any day. And my friends and I came to the hospital to pray with him one last time. And when we walked in the room, he was, heavily, heavily sedated. He was not eyes open, heavily sedated. But I remember thinking, even in this moment of it's about as dark as it gets before the light on the other end, he might be able to hear us.
Yeah.
And so we gathered around him and we prayed, and I don't know, there's not necessarily room in my theology, at least there wasn't until for what happened next. But I as I was holding his hand and praying for him, I felt the Holy Ghost tell me, intercede for him. Pray on his behalf. John was just getting into church himself. His walk with God wasn't deeply established.
Yeah.
He was trying. And then this whole thing happened. And I don't know if he'd ever been baptized. I don't know what his state with him and God was, but I felt almost like I had a flashback, or it felt like I was almost like a Catholic priest or something, like reading the last rites, and I felt like God was telling me, intercede for him and pray for him because he can't pray for himself.
Right.
And I don't, okay, can I do that? And I remember a verse came to my mind where Jesus tells his disciples, if you forgive anyone's sins, they'll be forgiven them. And I don't, maybe I should walk around thinking that I can forgive sins and that be part of my ministry is forgiving. But that's just not something I think about. It's not well integrated into my theology. but that verse came to my mind. I'm like, oh Lord, I hope I'm not doing something heretical here. But like,
Right.
can I pray for John right now and forgive his sins and then pray to God on his behalf? Like, does that work? To this day, I have no way of knowing. I know that God told me to do it. And I prayed, and it was a very powerful moment that changed my faith, changed my walk with God. I hope impacted John, and I
Yes.
believe I'll see him again one
Yeah.
day. But I would have never have had that experience.
Right.
My theology would have never been shaken. The
Right.
depth of the power of God to reach somebody, even at the doorstep of potentially
Right.
hell.
Right.
I would have never known any of that
Exactly.
had I shunned the suffering.
Right.
Hey, I got a meeting, I can't, like,
Right.
just anything,
Exactly.
the minorest of things.
Exactly.
I would have missed that.
Yes, and that leads me to say that in any circumstance, you don't know what God is going to do. I mean, when I was first diagnosed with MS, I thought my life was over. Mm-hmm. I really did, because I'd seen this horrible video about MS that was intended to get people to give money, and so it showed a worst case scenario. It was terrible. But if I hadn't had MS, I would never have done any of the work that I've done. Right?
We wouldn't be talking now.
We wouldn't be talking now. So you don't know what God is going to do. That doesn't mean you go to somebody, oh, it's a better thing that you're sick than that you're not.
Yeah, probably don't do that.
Right. But it does mean, just like you said, that God gives us these opportunities, and you never know what God is going to do. There's a song, can I think of the words? It says, can't remember the words exactly, but it says, even if God doesn't seem to answer, you don't know what he's doing. He's working in your heart. And so,
I have one last question on the topic of healing, but not from the same perspective as we've been addressing it. More the topic of societal healing. I know community, societal healing is not necessarily the same thing as the healing of the soul, but I think there are some parallels potentially. And I want this interview to be viewed for years to come, but at this exact moment in time that this interview is being recorded, the United States is in a period of particular, I would call hyper political polarization, a lot of anger right now due to some recent high profile tragedies that have occurred. And so when I think of our bodies needing healing, not just cures, but like we need to be made whole again. We need to restore our communities, our meaning, our integrity. When I think of that on the body level, I also think about that on a societal level, like how we need to be made whole as a nation. And I think about Jesus saying, blessed are the peacemakers, those who mend the bonds of relationship, who bring the wholeness. Blessed are the peacemakers. And just as I want the church to be peacemakers and facilitate wholeness for individuals who are suffering, I want the church to facilitate that same wholeness for communities and a society that's suffering. I know the church should become a culture of healing, a culture of peacemakers, but I don't know necessarily how to do that. Do you have any thoughts on this topic, expanding it out from the individual to society?
Well, I have some personal thoughts about it, because I think the church has the responsibility to be a model of something different. And we go, well, the church and church communities are just this little tiny part. But they actually did do some research studies which showed that a small community who are collaborating with one another, who are caring for one another, can have an effect on people who are not part of the community, because they begin to see it's a better way of living. And so then that begins to influence the way,
Like Jesus saying, "You're a city on a
that
hill."
they live. Yes. So I think, first of all, I think that the church must embody the love of Christ, but it must be seen to do so. You know,
Okay.
when I first, for a while, I became very cynical about Christianity because I looked at the church and I was very self-righteous and said, well, they're not living the way they say that they're supposed to live. So I kind of threw the baby out with the bathwater. But then I found a community that were living according to biblical values and that were living in a way that was more like the values of the first church, if you have. And the fact that I saw a group of people who were actually willing to do that, it encouraged me to see that really Christianity can be a powerful model for the way that we live. So, but I think that means we have to live by an alternative set of values, that we have to reject some of the cultural values I've just talked about, and we have to live by an alternative set of values. I think we need to live according to biblical values, but we must be seen to live these values every day of our lives. We must be seen to be a peculiar people. I mean, the Scripture says we're a peculiar people. We need to be seen to be a peculiar people. That means, of course, that you cause a lot of criticism, that people go, oh, I don't know about those people there. But that doesn't matter if you're living according to these values. But I think we need to be seen to live by these values. And that means in our marriages, in our homes, in our care for the elderly, in our care for each other,
The disabled.
in the way we educate our children, in our demeanor and our relationship with others who are not part of the church. And the Bible says, by their fruit, you will know them. And it also says, I think of John 13, I'm giving you a new commandment that you love one another, just as I have loved you, that you also love one another. By this all people will know that you are my disciples if you have love for one another. Right. And I think that we can do that, but we have to really make an effort to do that. We are not going to heal the whole culture. We are not. But we need to offer an alternative to say this is the way, this is the better way. And people who have open hearts will see that. And it will affect the way that they behave. And so, I mean, we have to absolutely reject hate. We have to reject hate and violence in any form. And we have to be seen to do that. And if we live a life of joy, which we do, then people will go, oh, well, that's different, you know. But I think I wanted to share this because while I was kind of cynical about Christianity, I had just come back from South Africa where there was tremendous turmoil in South Africa at that time. They were just trying to turn over power from the white government to the nationalist government, and there was tremendous. But I always had by my bed St. Francis of Assisi's prayer, and I feel like this is my prayer for me, but I think it can be our prayer for everybody. And it's, Lord, make me an instrument of your peace. Where there is hatred, let me sow love. Where there is injury, pardon. Where there is doubt, faith. Where there is despair, hope. Where there is darkness, light. Where there is sadness, joy. O Divine Master, grant that I may not so much seek to be consoled as to console, to be understood as to understand, to be loved as to love. For it is in giving that we receive, It is in pardoning that we are pardoned, and it is in dying that we are born to eternal life. And I think if each one of us can try to do that, we can make the world a better place.
We can be an example. You're right.
Yes.
I think that's a wonderful place to conclude this conversation. Thank you, Dr. Toombs, for all your time, for your study, for your career of study, for your modeling what it can look like, for your encouraging us to model what it can look like to care and be cared for as a community that has to deal with suffering, disability, and all of that. You've challenged me, you've inspired me. I know I took some pretty concrete action steps after our last conversation about technology, and I'm gonna have to really pray for God to help me understand like what needs to shift with how I view those around me in order to bring myself more into alignment with the type of community, the culture of healing that you're describing, as opposed to adopting the culture of the world. I'm thankful for everything you've poured into us, to me, to the audience, and thank you to the audience for tuning in. We're grateful for your attention, and we're looking forward to seeing you next time. Thanks for joining us. If you found this content valuable, please consider supporting us for free by subscribing, sharing, and engaging with us on whatever platform you're most comfortable with. And if you'd like to support us financially, you'll receive premium and early access content. Lastly, please check out all the cool things we're working on by going to reflectiveecclesia.com. Thanks.